I want to talk about menopause a little bit. So let's have a discussion over the next few minutes. I can't be on long, but over the next few minutes, let's talk about menopause and why so many women are miserable when it comes to menopause, and why so many women have actually started to look at menopause, and even in the medical community, they started to look at menopause as some kind of terrible illness. The reason why we're looking at it now as an illness, and it's just a natural progression of a woman's lifespan, is the reason why we're looking at an illness is because so many women are suffering. They're having a terrible time as they hit menopause. There's a lot of misconceptions too when it comes to menopause. So let's cut through the misconceptions, and let's talk about how menopause can be better for you. And so if you ever wondered, like some people say, yeah, like my mom went through menopause and it was fantastic for her, had no issues, no problems. It was like an on switch and then it was an off switch, maybe a couple of hot flashes. But how many women are suffering with menopause right now? And they've been suffering with it for 5, 6, 7, 8, 9, 10 years. And we think that this is just something that is normal, and it's not. So let's talk about menopause. Let's cut through some of the misconceptions, and let's talk about really what you need to be looking at when it comes to having symptoms of being miserable after menopause, all right? Now I know what you're thinking. How is a man going to talk about menopause? And listen, I would prefer that I don't have to talk to menopause, but there's a lot of, I guess, female doctors that don't understand it, so I'm going to give you my perspective. And in reality, it doesn't matter if you're a man or if you're a woman. You can talk about these things because we're just going to talk about physiology, okay? We're going to talk about physiology. Maybe in next slide, I'll talk about menopause, all right? And that's a misconception too, because men aren't supposed to go through some kind of transition as they get older. And we've actually have proven that with, looking at, testosterone in people in their 60s and 70s, all right? So let's talk about this, and let's talk about some of the symptoms, why you're having some of the symptoms, and again, cut through the misconceptions and really say, hey, here's where you need to start as far as with menopause. I remember I had a patient, this was about, probably close to 10 years ago or so, and had a woman who said, you got to help me. I've had migraine headaches, and I've been having hot flashes for 20 years, if you can imagine that. So, and I remember, just through chiropractic, migraines went away. She was still having some hot flashes. And I remember this was like early on. And honestly, guys, I didn't really know what I was doing 10 years ago, not to the level I know how to do right now, which always makes me wonder when people are talking about hormones and things like that, if they really know what they're talking about. But I remember we did some things to help with her estrogen metabolism. And lo and behold, the hot flashes actually went away. And again, I really didn't know what I was doing, but someone's like, hey, try this for, quote unquote, estrogen detox. But I didn't know what it was actually doing, and now I understand what it was actually doing. So let's talk about menopause, okay? Now, here's the thing, okay? Let's talk about a woman's hormones once she reaches menopause. Now, how do you know if you've reached menopause? Well, there's different kinds of what they would call menopause. And by the way, there's no such thing as perimenopause. Anybody who says perimenopause, they don't know what they're talking about, because really what drives a woman to menopause, and that's actually not having any more eggs to release from the ovaries. Once the egg reserves are gone, then you enter into menopause. And the reason why is this: what is driving the estradiol and the progesterone levels to a higher level up in through here? Well, what's driving those levels is actually the release of an egg and then the corpus luteum, which is actually maintaining those progesterone levels, and that's why we have a cycle, okay? So they actually medically describe menopause as if you don't have a menstrual cycle for 12 months. Once it's reached 12 months, then they say, yes, you have in fact reached menopause. However, you can actually, if you haven't been having a menstrual cycle, you can actually measure what's known as FSH, follicle stimulating hormone. And if it's really, really high and you're not having a menstrual cycle, then it means that most likely, yes, you actually have reached menopause and you have no more eggs in reserve. So that means that you've hit menopause. So what's the normal age that you should be hitting menopause? And it's going to depend on when you hit your first menstrual cycle. So if you hit it at 10 or 11, I'm kind of like, uh-oh, there's probably some issues that are going on if you are hitting the menstrual cycle so early. But if you hit it earlier, you're going to actually hit menopause earlier. So it may be in the late 40s. If you hit it at what we would consider a normal time at about 14 years of age, then you might be going into 51 or 52 years of age. I know that we take care of a lot of women that are, hitting the late 40s and are hitting the early 50s, and they're saying, well, I don't know if I'm in menopause right now. And so we've had a lot of women who are saying, yep, according to testing and things like that, you've actually are in menopause. So what happens though that makes a woman feel so lousy when they enter into menopause? And a lot of the reason is because of this, is that once you hit this area of menopause, then what happens is that your estradiol levels and your progesterone levels, you're still going to be producing it, but you're going to produce it in lesser amounts, and it's not going to be coming actually from the egg and the corpus luteum after the egg is released. It's going to be coming from other areas. So yes, you can actually, the ovaries do secrete a little bit of estrone, which is a type of estrogen, from the ovaries even after menopause, but a lot of where your estradiol and your estrone is going to be coming from is it's going to be coming from the adrenal glands. So here's what stays consistent. Your testosterone is going to stay consistent, and then you're going to see your estradiol levels drop, and then a lot of it, your estradiol levels and estrone, which is also a different type of estrogen, is going to primarily be made from the adrenal glands. And some of it also, a tiny amount from the ovaries, but some of that then is also going to be what's known as aromatized from a testosterone derivative in your fat cells. Okay, so some of it is actually coming through your fat cells. Just remember that. Okay, so you're obviously going to you're going to have less estradiol, and your progesterone is going to be produced by your adrenal glands as well. So what can cause all of these crazy type symptoms is if you go into menopause and you're having an elevated level of estradiol after you hit menopause. And there's going to be a lot of reasons why you're going to have this elevated level of estradiol, also known as estrogen dominance. So the more that these right here are actually further apart as far as where they need to be, because they need to be closer together, because progesterone will balance out some of the effects of the estradiol. So when you have very low progesterone, but you still are hanging on to a lot of estradiol, that's when you can start to have a lot of the crazy symptoms that are associated with menopause. Now, here's what, unfortunately, a lot of natural doctors and even the medical community will do, is that they'll do some kind of bioidentical, and they'll try to get that progesterone level up in order to get closer to the estradiol levels. And that's where you can run into some problems, because if you take a bioidentical, yes, you will in fact feel better. So a lot of ladies are saying, oh, I felt so much better once I got on a progesterone-based bioidentical, something that they manufactured naturally. But the problem is, guys, is if you feel better, but you leave that estradiol still high and still unable to metabolize it, then what's going to happen is you're still going to have some problems with certain organs that contain estrogen receptors. So I want you to think of like breast cancer or uterine growths, things like that, because they're still going to be responding to those hormones. So the key is not to just try to jack up the progesterone. The key is that if that estradiol level is remaining up, really figure out why your body is hanging on to so many estrogens. So think liver, think fat cells, think your insulin levels. So think of that, because you have to be able to properly metabolize it. It just so happens though, guys, that if you have problems with your menstrual cycle, or you're having some problems with lifestyle, if you're having those kind of problems when you are considered fertile, guys, those problems don't go away when you reach menopause. In fact, they will get exacerbated, if that makes sense. So let's talk about this. Here's some signs that menopause is not going so well for you, okay? So I'm going to talk about you if you have actually gone through or transitioned into menopause. If you're not in menopause, pay attention, because eventually it's going to happen to all women. But here is some signs that things aren't going so well. So hot flashes, Some mood swings, abnormal weight gain. Here's what's interesting is that you'll notice a lot of women will say, yeah, I hit menopause and I just started to gain weight and I started to get kind of a pooch. And the reason why is yes, you're going to have decreased circulating estrogens, which means you hit menopause and you will kind of lose your shapely figure, and you will then tend to actually deposit fat, kind of how men deposit fat, which is going to be, in the gut. Now, this doesn't happen to all men because there are some men who have very high estradiol levels, and they tend to put their weight on in the boobs and in the butt, and and then not around the belly, and in the back of the, and in the back, right above the butt. Okay, so. But it just changes, and it actually will signal a difference in fat deposition. You'll experience poor sleep. You may experience low libido. You also may experience vaginal dryness, okay? I hope my mom is not watching right now because I just said vaginal dryness. Oh, hey mom, how you doing? So you can have all of those different issues, and this is actually related to your hormones, okay? So this is related to your hormones, and really what it means when you break it all down is that your hormones aren't doing very well when it comes to menopause, okay? So if you have one of those symptoms, go ahead and give me a thumbs up, put a comment and say, yep, that's me. Just put a comment in there so we know how many people are actually having some issues when it comes to that. Here's what's interesting about hot flashes. About 80% of women do in fact have hot flashes when it comes to menopause. Actually, what the literature shows is that they say ultimately we really just don't know what exactly is causing this. Some of it can be if you have a big difference in estradiol and progesterone. Some of it can be as you get some diminishing changes in your estradiol levels. It actually will change, kind of your set point of what your temperature is. So mood swings has a lot to do with, estradiol, and also like the how things like serotonin neurotransmitters and things like that are metabolized, things like adrenaline and things like that. So poor sleep also can be some issues when it comes to I'm not sleeping well because I'm getting hot flashes, but also this can be in relation to things like your adrenal glands and cortisol and things like that. When it comes to libido, remember your adrenal glands are actually responsible for the production of testosterone. So again, we're going to say after menopause, really an organ that you really need to take care of is going to be your adrenal glands, because this is really where most of these hormones are actually coming from. Vaginal dryness too. So, you're going to have decreasing levels of estradiol, and actually, the outer part of the vagina is in fact responsible, because remember, estradiol is very, it's androgenic. It produces tissue and it provides for lubrication and things like that. So if you have those symptoms that are going on, and I'm actually seeing that none of you are actually commenting, because I know no one wants to admit, yes, I'm going through some problems with some symptoms of that menopause is not going very well, okay? So here's how you know how well menopause will go, okay? Here's how well you know, whether it's something that you just kind of skate through, or it's something that you are being miserable and you're just suffering from. So whether you're at menopause or whether you are, approaching it, or you might be in your early 30s, well, here you should be getting tested, because you'll see how well menopause is going to go for you. Okay. So number one, remember this: mental stress. So when you talk about progesterone, remember your progesterone production is going to be dependent on your adrenal glands. And so remember, the adrenal glands are producing so many different hormones: pregnenolone, DHEA, which is responsible for your androgens and testosterone conversion. It's responsible for a little bit of the hormones with your estradiol. So it's responsible for even blood pressure hormones, responsible for your kidney hormones, the angiotensin-renin cycle between the lungs and between the kidneys and the adrenals. That's controlling actually, your blood pressure and your water balance, salt balance, electrolyte balance. Heck, it's even responsible too for, the communication between the adrenals and the thyroid. So when you are mentally stressed, remember, you have a lot of stress. You got to make stress hormone. You got to make cortisol. And so you only have so much pregnenolone to be able to metabolize into cortisol. And if you're always stressed, it's going to take that pregnenolone, and instead of making progesterone, it's going to turn it into stress hormone like cortisol, okay? Number 2, blood sugar dysregulation, okay? So if you are pre-diabetic, just remember, is you can hide it a little bit better when you're fertile. But once you start having some issues after menopause, or you have some blood sugar issues, you will notice that this will become very compounded. And the reason why is everyone who's got a lot of blood sugar dysregulation are going to have a lot of cortisol issues as well. So don't just check your blood sugar. Make sure that you are checking what's known as A1C, which is basically like a 90-day blood sugar average, okay? Because listen, you could come in and we check your blood sugar, and right before you got here, you almost got in an accident, and yes, you're going to spike a stress response, and yes, your blood sugars are going to be elevated as a result. And then you pull the blood and you say, oh my gosh, I think you might be diabetic. No, you want to get a 90-day average, because those things are going to ebb and flow throughout the day. So you want to see what your average blood sugar is for 90 days straight. And the other one is actually measuring insulin. So even if people have normal blood sugar or normal A1C, but you start seeing those insulin levels start to creep up, it means that you are not hearing insulin very well. And so that pancreas has got to scream louder and louder and louder in order to try to bring those blood sugars back down and to store those blood sugars, you know, either in the form of glycogen in the liver or in the muscle tissue, or also to store it into fat cells. So you get some blood sugar dysregulation, menopause is going to be bad for you. How about inflammation too, guys? You got a lot of inflammatory issues that are going on. Remember, the more inflammation that you have, the more it's going to affect your hormones. So hormones are only responding. They are not causing. Yes, they will make you feel bad, but no, they're not making you sick. Your hormones just don't go bad for no reason, which is beyond me why someone would want to just give all of these different bioidenticals without trying to figure out what the problem is, because remember, hormones are just responding. So inflammation, things like food allergies, gastrointestinal inflammation, liver inflammation, how are all of those things playing a part? Are you having some kind of infection that's going on? So you got to be looking at inflammation as well. And then also you got to look at what's known as poor liver function, otherwise known as methylation, okay? So methylation, so what is methylation? Methylation is literally taking a carbon and 3 hydrogens and taking it off from one and adding it to another, and that helps actually all over the body, nitric oxide production, turning arginine into creatine, which all these athletes are like, I take creatine. Well, if you're methylating properly, you wouldn't need creatine. But all these other things, nitric oxide production is absolutely huge when it comes to your arteries, the health of your skin, things like that. But when you come specifically to the liver, methylation, it needs to happen in order to be able to metabolize and remove your hormones. Remember, those hormones are always going to be turning on. You're always producing more hormones. You better get rid of them. Otherwise, you're going to see a buildup of hormones. So if you are not methylating very well, then yes, you can tend to actually see a buildup of specific hormones. So, ladies, let me ask you a question. Are you mentally stressed? Do you have any kind of blood sugar dysregulation? Do you have any inflammation? And do you have poor liver function, guys? And yes, even what can contribute to poor liver function, yes, can be, over consuming fructose and high fructose corn syrup. Alcohol, anything that can inflame the liver can produce so many issues, including bile acid production. So look at those things, and you may be wondering, like, I don't know if I have a problem with those 4 things. Well, guess what? Have you been tested? Have you been tested? Okay. So have you gotten a Dutch test? Have you actually gotten some kind of blood test in order to measure A1C and your insulin? Have you gotten a food allergy test? Do you know what your C-reactive protein is, or homocysteine levels? Those are actually some good starts when it comes to actually looking at those 4 different areas, okay? Now, I had someone who asked me this question, and this was just kind of the impetus of why I wanted to talk about it, because I know that if someone has a question regarding this, chances are that you probably have this question as well. So, Dr. Nate, do you have any recommendations for women who have had a hysterectomy before reaching menopause? And I'm glad you asked that, because yes, I do. So you have, like, if you're 51, 52 years of age and you're reaching menopause when you're supposed to. However, there are some women who are put into an artificial menopause, and the reason why is because they've had a hysterectomy. So a lot of times if you had a full hysterectomy, the uterus they've removed, the ovaries they've removed, sometimes it's just the uterus. And why do they remove the uterus? Because you might be having some uterine fibroids, or you're having some abnormal bleeding. This drives me nuts. And they go in and they say, well, just remove the ovaries anyway, because you don't need them. Yes, you even need the ovaries even after menopause. And so if you've had that hysterectomy because you might have had fibroids, you might have had some abnormal bleeding, guys, I'm going to tell you this, it wasn't a problem with your uterus. It was a problem with your metabolism of your hormones. Why would you rip out the organ that's screaming the most? It's just causing the symptom. It is not the problem. So if you've had a menopause, we can't put those organs back in. And if you are in this artificial menopause and you really shouldn't have reached menopause yet, I'm going to tell you something. You should be supplementing with some like glandulars. And the reason why is because as soon as you start to hit menopause, you will catch up when it comes to things like heart disease. If these things are off, you will start to really go fast when it comes to bone density loss. And so you think about it, you have a longer time to be in menopause. You just have a longer time for these problems to continue to develop. So if you are a woman, you've had a hysterectomy, and you haven't reached the age of, anywhere from 49 to maybe 52, 53 years of age, here is what you need to do, like right now. Number one, get on a female glandular. Now, this is just a broad recommendation, but why would you be on a female glandular? So we will give female glandulars, which basically what it is it's animal constituents of ovary, of uterus, things like that. And I want you to know something. Like will help like to heal and repair. So if people have some issues when it comes to the liver, we will give them a lot of desiccated liver. Someone is, absolutely adrenals are tanked. Yes, we will actually give them the outer part of the cortisol, so the adrenal cortex. And the reason why is because those things will have the constituents for those cells to be able to rebuild and be able to repair. So a female glandular is going to have some constituents when it comes to uterus, when it comes to ovaries, and it will have the proper enzymes, proper constituents and things like that to help rebuild and help repair. If you don't have them, then what it will lend is it will lend a lot of the substrates in order for better hormone production actually to take place. And in fact, when someone has been on things like and haven't had a menstrual cycle for a long period of time, maybe they've actually are considered quote unquote perimenopause, which means they might be 40 to 49. They're starting to have abnormal menstrual cycles. Well, guys, it's not that something is just like, I'm going to have it here and there. What it really means is that there's some big time problems that you should be having a menstrual cycle, and that there's so much damage that has accumulated that now it's actually throwing off your estradiol, your progesterone, and it's throwing off that whole 28-day rhythm. So female glandulars are great. So if someone's been on birth control, for example, we had a woman, she actually got off of birth control. They were not helping her at all. And I said, well, in order to help that recover, go on some female glandulars, for a while until we can get that menstrual cycle back after going off of birth control. Lo and behold, in 4 weeks, menstrual cycle actually came right back. But I've seen some women it's taken 4, 5, 6 months after birth control for that to come back. And that really just means is that the problem still hasn't been corrected when you actually go off of birth control. Another one that I absolutely like is called ashwagandha. Ashwagandha, it's actually really one of my favorites, and it's considered an adaptogenic herb. An adaptogenic, which means this. You guys understand that medications are manipulative. It doesn't matter what's going on, it's going to lower it. Take blood pressure medication. Even if your blood pressure is normal, it's going to lower it 10 to 15 points, and it doesn't matter. When it comes to adaptogens, what they do is they tend to raise or tend to lower based on what the body needs. And the reason why I like ashwagandha so much, especially for women after menopause, is because if you tend to be high in cortisol, it can help to bring it down. Or if you tend to be really low in cortisol because some of the things that you're actually going through, it can tend to start to bring it back up. Remember, cortisol is neither good nor bad. It's just responding to what's happening with things like stress and blood sugar and things like that. So ashwagandha is really, 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 really good, and I love it. I actually take it because obviously for me, if I tend to work out a lot, you know, I can tend to just jack up my cortisol all the time. So it helps to keep that in balance. So those are just two things. And obviously there's a lot of other things that we could talk about, but female glandular, if you have had a hysterectomy, a partial or full hysterectomy, you know, get on that, especially if you should actually be having a normal cycle. So this is really for ladies with a hysterectomy that are in their late 30s and 40s, you know, and they haven't reached 50, 52 years of age, right around that time, okay? So just remember this, guys, when it comes to menopause, uncorrected problems before menopause become magnified after menopause. So just if you've got uncorrected problems going into menopause, it's just like taking a magnifying glass and you start seeing some of those issues will really start to play its way out after menopause. It's not the menopause in and of itself that's causing the symptoms, it's these right here. It's these uncorrected problems that your doctor has not led you through and navigated them through, but they've just thrown a bunch of medications and said, you know, go, you're either too stressed or you're just depressed or I don't know what's going on. Here's a medication for it. So you haven't corrected it and it just becomes magnified once you reach menopause. And just remember this, if you have had a hysterectomy, removing the organ that's symptomatic is like ripping out the tongue of a screaming baby. I know that's kind of a morbid thought, but I want you to think of it because unfortunately we can't undo what has been done in the past. But, you know, I desperately want to make sure, you know, to tell ladies, please keep your organs, please keep them. The whole idea of a hysterectomy, think of this. It's called a hysterectomy, and how chauvinistic is this? This is terrible. It's called a hysterectomy because hysteria, and ectomy means removal. And it's called removal of the hysteria, which they thought that the reason why women got crazy was because of their uterus and because of their organs. The thing that made you a woman was actually what was making you crazy. So they thought if we remove it, we'll remove the reason why a woman becomes crazy. So even back in the 1600s and the 1700s, the 1800s, when these things were happening and most of them were dying on the operating table, this was happening because, yes, even 200 years ago, women could, yes, in fact, have some hormone issues. Now, it didn't happen as much as it does now, but guys, taking out your ovaries and your uterus because it's symptomatic, like I said, is trying to rip out someone's tongue because they're just screaming too loud, okay? I know it's kind of a morbid thought, but you're basically just removing the symptom and you're leaving the problem still there, and the problem is estrogen metabolism, okay? Or blood sugar, all those things that we actually talked about. So hopefully, guys, that makes a lot of sense for you.